Let's move to our fifth and final section, in which we will talk about some other treatment options for the treatment of germ cell tumors of the testes, which will be like post-chemotherapy surgery. So we already discussed about the chemotherapy for the seminomas and non-seminomas, and the different drugs, chemotherapeutic drugs used, and what are their side effects. Now, in other options, they're post-chemotherapy surgery. So after the chemotherapy, surgery can be tried, salvage chemotherapy, and then we can try extragonadal germ cell tumor and fertility associated with those tumors. Post-chemotherapy surgery, resection of residual metastasis. So after the chemotherapy, if there are residual metastasis present, then we should do the resection of residual metastasis. All sites to be resected. Residual retroperitoneal disease, we should do the modified bilateral retroperitoneal lymph node dissection. Less frequent thoracotomy, unilateral or bilateral, and neck dissection can also be done. So all these are different the surgical options after the chemotherapy, in which retroperitoneal lymph node dissection is done, and also the thoracotomy. Otomy is opening. Thoracotomy and neck dissection can be done. Presence of viable tumor, frequency of teratoma or viable disease highest in residual mediastinal tumors. So if there are residual mediastinal tumors, there is increased frequency of teratoma or viable disease. Necrotic debris or mature teratoma, no further chemotherapy is done. A viable tumor completely excised, 2 additional cycles of chemotherapy can be done. So if the tumor is mature teratoma and there is necrotic debris, we should not do any further chemotherapy. But if there is viable tumor that is completely excised, then we should try 2 cycles of additional cycles of chemotherapy. Initial histology, pure seminoma. Mature teratoma, rarely present in this case. Frequent finding is necrotic debris, and we said if necrotic debris is present, we should not go for another chemotherapy. Residual retroperitoneal disease, complete, we have resection of the lymph node is difficult. Extensive post-chemotherapy fibrosis. Observation is recommended. Positive findings on PET which correlate with viable seminoma in residua, and mandate surgical excision or biopsy. So if the initial histological picture gives pure seminoma, in that case the teratomas, they are rare. The mostly frequent finding is necrotic debris. If residual retroperitoneal disease is present, we should do the node dissection. If extensive post-chemotherapy fibrosis is present, observation is recommended. Positive findings we have on positron emission test, and it mandates surgical excision or biopsy. Salvage chemotherapy, combination of vinblastine, Ifosfamide and cisplatin is used for the salvage chemotherapy. Durable complete response. Substitution of paclitaxel for vinblastine associated with durable remission. Primary mediastinal non-seminoma. This therapy is rarely beneficial, which is vinblastine, ifosfamide, and cisplatin in a primary mediastinal non-seminomas. High-dose chemotherapy or surgical resection is done if it's primary mediastinal non-seminoma. Then the chemotherapy, which is vinblastine, ifosfamide, and cisplatin, is not very helpful. In that case, we should do the high-dose chemotherapy or surgical resection. High-dose carboplatin and etoposide is also the salvage chemotherapy after ifosfamide containing high-dose complete response in 25 to 40% of cases after ifosfamide containing salvage chemotherapy. High-dose therapy in those with relapsed or refractory disease, paclitaxel active when incorporated in high-dose combination. So again, some salvage drugs, salvage chemotherapeutic drugs. In high-dose carboplatin and etoposide, there is complete response in 40% cases after ifosfamide containing salvage chemotherapy. High-dose therapy in which paclitaxel, which is active when incorporated in high dose. Cure still possible in some relapsed patient, although the cure rate in relapsed patient is not very good, but some cases they can be cured. And then there are some chemotherapeutic drugs which we can use in the recurrence case, which include the ifosfamide and paclitaxel. Extragonadal germ cell tumors prognosis depend on the tumor histology, site of origin. Diagnosis by testicular ultrasound examination, primary mediastinal non-seminomatous germ cell tumor, poor prognosis. We know for non-seminomas we have one classification, that is poor prognosis, poor group, and that is with the mediastinal non-seminomatous carcinoma. Associated with hematologic disorder, leukemia, myeloblastic syndromes, and also thrombocytosis. So all these are different complications associated with mediastinal non-seminoma, and it has poor prognosis. Non-seminoma of primary site, malignant transformation, and isochromosome short arm 12p in transformed cell type is present. Poorly differentiated of unknown histologies. Standard cisplatin containing chemotherapy is used, and the origin is from primitive germ cells. Heterogeneous neuroepithelial tumors and lymphomas. Fertility, important consequence of treatment, azoospermia or oligospermia. So the sperm side is either completely absent, azo, or there is decreased number of the sperm that are associated with the infertility. Ejaculatory dysfunction occurs with retroperitoneal lymph node dissection. If the nerve sparing procedure is done, then we can preserve this problem. Germ cell damage from cisplatin containing chemotherapy. Nerve sparing technique, again, as I mentioned, is less likely to cause the problem. Spermatogenesis reoccur in some patients. They start forming the sperms. Risk of impaired reproductive capacity, semen analysis should be done, and cryopreservation of sperms can be used to treat the infertility. So that concludes our topic of testicular cancer, in which we talked in detail about all the epidemiology, incidence, different types, classification, treatment of the different stages, seminomas, non-seminomas, and the fertility problem associated with the treatment, and different chemotherapeutic drugs and their side effects. So thank you for watching sqadia.com.